How to interpret TB test results with false positives. Imagine getting a positive result on a tuberculosis test and feeling confused about what it really means. It's important to understand that not every positive test indicates an active infection. Sometimes, tests can show false positives, meaning the test suggests TB infection when there isn't one. This can happen with both the Tuberculin skin test and Interferon-Gamma releases assays. Knowing why this occurs helps in making better medical decisions. The Tuberculin skin test involves injecting a small amount of purified protein derivative into the skin and then measuring the skin's reaction after 48 to 72 hours. If the skin becomes swollen or raised, it's considered positive. The Interferon-Gamma releases assays measure immune response in the blood, looking for signs of TB bacteria exposure. Both tests detect immune system sensitization but cannot tell if the infection is active or just latent. False positives can happen for several reasons. One common cause is prior vaccination with Bacillus or BCG. This vaccine can cause cross-reactivity, especially with the skin test, leading to a positive result even if you don't have TB. Exposure to other mycobacteria, like Mycobacterium cancericea or Mycobacterium marinum, can also trigger a false positive because they share similar antigens. Errors during testing, such as incorrect administration, reading, or lab mistakes, can also lead to misleading results. Sometimes, nonspecific immune activation from other inflammatory conditions can cause a false positive in blood tests. When you get a positive TB test result but have no symptoms or risk factors, it's more likely to be a false positive. In such cases, your healthcare provider might recommend retesting after some time or using different tests to confirm. It's also essential to consider your medical history, including whether you received the BCG vaccine and if you've been exposed to environments where TB is common. If a test result is unexpected, your doctor may suggest additional steps. These could include chest X-rays, sputum tests, or microbiological cultures to check for active TB disease. Sometimes, a second test called a two-step Tuberculin skin test can help distinguish between a true infection and boosting of the immune response from a previous exposure or vaccination. Guidelines emphasize that no single test should be used in isolation. Healthcare providers consider your history, risk factors, and test results together. If results are ambiguous, consulting TB experts or infectious disease specialists can be very helpful. The goal is to avoid unnecessary treatment, which can cause side effects and anxiety, while ensuring that active infections are properly diagnosed and managed. In summary, interpreting TB test results with false positives requires a careful approach. It involves understanding the limitations of the tests, considering your personal health history, and sometimes repeating tests or conducting further evaluations. Always seek personalized advice from healthcare professionals to get the most accurate diagnosis and appropriate care. Remember, accurate interpretation helps prevent unnecessary treatments and ensures those who truly need help receive it.